We've seen the headlines, we've heard the concerns, and we've probably all taken part in the great GP debate. Is it hard to get a face-to-face appointment? Why is it difficult? And what is the reality at the sharp end of care? Most importantly, is there anything we can do to help? Healthwatch Norfolk was invited to St Stephen's Gate Medical Practice in Norwich to find out. It was access all areas, subject to keeping patients safe and maintaining confidentiality, to find out the reality of day-to-day working life. And we're better to start than in the place where those initial phone calls to the practice are answered.
Very busy. I started here November 2020. So when I started, I thought we wouldn't be doing face-to-faces. I thought we wouldn't be, doing too much. I thought we'd be signposting to other places. But since I've been here, we've, even during November, December, we were doing a lot of face-to-faces. And our phone lines, we've got the duty list, which is on the day emergencies. It's only been an hour and 20 minutes, and we've got about 30 patients that have phoned through already this morning that are going to get on the day care and, on the day advice. So yeah, we've been very busy.
Next stop, reception, the face-to-face front line, where the team, nominated for a national award, were there to provide advice and guidance.
So I'd like to send a reassuring message, really. So I don't think patients need to be worried about coming into the surgery. There are precautions in place just to obviously make sure that there is no transmission of any virus or anything at all. It may be COVID, it may not be, it could be any virus at all that can cause illness. Obviously we don't want to forget any other viruses around the area as well. It's just a matter of precaution. Obviously we don't know how long these will be going on for, but our main message is obviously safety to our patients. Over 50% of our appointments are face-to-face now, and people say that throughout the pandemic, obviously we speak for ourselves, we don't speak for other surgeries. In this case, our doors may have been closed, but that doesn't mean that patients aren't coming through. Most appointments that need an examination or anything like that will be seen face to face.
Behind the reception team and GPs are a huge team providing extra support. This is the prescribing hub, which deals with incoming prescription requests, the authorisation of certain medication, and dealing with discharge letters. The specially trained staff take this work on to free up the time of doctors. The doctor's workload is also eased by the Duty 3 team. Let's meet one of them.
So that's supporting the duty doctor with the urgent calls that are coming in. The duty doctor will then send me some messages to arrange face-to-face appointments for patients who need to be seen. What I also do as well, our patients who are housebound will obviously need somebody to go out to them. So also on behalf of the duty doctor, I will arrange the referrals. As well as doing that, I'm also working on our reception tasks. At the moment we have over 200. They're tasks that come in from the clinicians on a daily basis. To ask us to book follow-up appointments, things like blood tests. So we triage so they get the best appropriate appointment. We wouldn't want them to book an appointment themselves with a nurse when we know that they need to see a doctor. So it's just making sure that the patients are seeing the right people to help them.
Just a snapshot of some of the support services offered by St Stephen's Gate. There are more, and the building's also carrying out some surgery as well. For example, it's carried out more than 1,000 cataract procedures since the start of the pandemic. We've met some of the team, but what are the facts in terms of appointments and demands for St Stephen's Gate? Practice manager James Foster.
We had our figures from NHS England that showed during the course of the pandemic we had 120,000 appointments. Of those, 75,000 were face-to-face and around 35,000 were appointments on the day. We've been delivering comprehensive, if you need to be seen you will be on the day, as well as a range of appropriate telephone and face-to-face appointments. A lot of practices anyway tend to be seeing the same number of patients face-to-face, but have added a load of telephone calls on top of their normal work. So what you're seeing is a reduction of face-to-face as a percentage, but the overall appointments has increased 8% year on year, and I think the figures from 2019 before the pandemic struck, September, there were 13% more appointments delivered by general practice this year than 2 years ago. The number of appointments and points of access is increasing all the time. There's a pressure on the NHS. The hospital has got a backlog, cases are growing in complexity, patients are having to wait longer for treatment. Those are a reality. I think what I would say to patients are, if you think that we're trying to do the best for you, then that honestly we are. So there will be difficulties, there will be some positives, there will be some negatives, but we are honestly working flat out. People are working long hours, long days in order to try and look out for the best of you. I mean, our philosophy here is to make other people's lives better. That's how we work, that's what we want to do, and it is really what we can do, and that's the NHS. It wants to help you. Where it can't, it's often because of pressures that are outside its control.
A busy and challenging time for the team, but a great opportunity to see the issues they face while helping keep us safe. Get in touch and let us know your experiences too.